Ladies and gentlemen, welcome to the Interview with Experts Season 6, proudly presented by Malaysian Dental Students Association, MDSA. My name is Dylan and I am the representative of the Academic and Research Bureau of MDSA. For today's episode, we are very honored to have with us Professor Dr. Eswara Uma, a very experienced pediatric dentist and also currently the head of Department of Paediatric Dentistry of Malacca Manipal Medical College. Good afternoon, Prof. Uma.
Hi, Dylan. Good afternoon. Thank you very much for inviting me for your experts conversation with the experts. I'm really delighted to be here, and I'm really excited to share my experiences with you.
Yeah. On behalf of MDSA, I'd like to thank you for accepting our invitation to be our special guest for today.
Thank you so much. So let me know how I can help you, Dylan. So let's get started.
All right. So first off, could you give us a brief introduction of your background and how did you come about choosing pediatric dentistry as your area of expertise?
Okay. So as far as my background is concerned, I'm from India. I come from a place called Vizag, which is in the southern state of Andhra Pradesh, and it is known for its beaches, and it is also known for its strategic location as far as Indian defense is concerned. However, I grew up in the north of India in a place called Chandigarh, which is about 250 kilometers from the national capital, New Delhi. I was brought up there by my parents because my parents were there at that point because of the nature of my dad's work, which was in the defense. So I practically grew up in the north of India. And then when the time came for me to pursue my higher education, I actually wanted to do medicine. But in India, in order to get into any professional courses, especially medicine or dentistry or engineering, and that too in the public universities, we are supposed to write what we call as the competitive exams or the entrance exams. So, and there are limited number of seats, and depending on your merit, you get selected. So the first few ones who are in the merit list get selected for medicine, then comes dentistry.
Similar like NEET, right? The NEET exam?
Yes, exactly. Now it is called NEET, but earlier it was every state used to have its own exam, now they have combined up the whole thing. So I got offered the seat in dentistry. In my family, we were clueless about dentistry other than knowing that dentistry is something to do with pulling out people's teeth, and that's about it. So we had no clue whatsoever. Yep. However, my parents and my uncle advised me. They said, well, you don't know anything, just take a jump in it and make a career out of it for yourself. I took their advice, and then I had to move away from my house, and I joined a public university in the state of Andhra again, in Hyderabad. 5 years I was there. I made great friends with my classmates and my seniors. I'm still in touch with them. And once I finished my internship, I had to move back to be with my parents, because I was also offered what we call as residentship in a premier institute of India, which is called Postgraduate Institute of Medical Education and Research, which was in Chandigarh. So I was offered, I cleared the exam and I got selected for junior residentship. So I moved back with my parents. However, my friends stayed back, my batchmates stayed back, because they were preparing for their postgrad entrance exam. So since I had already cleared one exam, so I was very confident of myself. I said, okay, I can do it. There's nothing which can stop me. And I said, okay, I can just clear any entrance exam. And when the time came for the entrance exam, my friends cleared, I couldn't. I did not clear. That was the rudest shock of my life. And that brought me crashing to the ground. I said, okay, this is not it. You don't know everything. You need to really work hard. So that's when I decided I'm going to take a year's break and study all over again, prepare for the exam, because preparing for the competitive exam is a different ball game. It's a different kind of study. So I collected all the material. I started preparing. And meanwhile, the Army Dental Corps in India, they were recruiting dentists. So they called for applicants. I applied. I got selected. The written and the physical and everything, and I was all set to join the army. And then while I was doing my postgrad, my junior residentship, the same place in the prestigious institute, they announced that there was one seat open for postgrad in peds. So here I was, I did not clear one entrance, and this was one seat. So I told myself, what are the odds of getting it? You didn't get through in an exam where there were so many seats, and now here is one seat. There's no way you're going to get it. So I didn't even apply. But then my friend, a very good friend of mine, she asked me, hey, you know what, the entrance is there, did you apply? I said, no, I did not apply. What are the odds? There's one seat, there's no way I can get it. She said, never mind, why don't you apply? And she literally dragged me, and I filled up for register for the exam on the very last day before the closing day. And I forgot about it. Then I wrote the exam, and it was the same friend who called me and said, guess what, you got the seat, you got selected for that one seat. I was shocked. And yeah, so I said to myself, okay, this is a thing with this is a chance this is an opportunity, not a chance, this is an opportunity which has been given to you. Grab it with both your hands and just make something out of it for yourself. And I dived into it completely. It was a lot of hard work, sweat, tears, but I have no regrets whatsoever. It is worth every sweat and tear I spent. And looking back, I'm so indebted to my friend who made me fill up the form that day. Number one.
Good friend.
I'm really great. Yes, because she couldn't qualify, I qualified. And secondly, very indebted to my family, to the so many friends of mine, friends, colleagues who have shaped me with their advice, with their guidance. Colleagues, not only dental colleagues, also colleagues, a lot of friends. I have a lot of friends on the medical side with whom I talk a lot, learn a lot from them. And they have, till today, they have kind of, enriched the whole experience in the past 23 years, sorry. And I'm still learning from them, and the journey is not over, it's still ongoing. So I'm so grateful of every single person who has contributed in every single way, however small it is. I'm so grateful to them. So if you ask me, how did I end up being in pediatric dentistry? I have one word, and that is serendipity. That's it.
Wow, that's a very long story. So
yeah,
it takes a lot of perseverance and dedication to become a dentist who specializes in treating children. And these people, they are very lively and adorable. It's fun working with them. But sometimes it could be challenging to have them to comply with the treatment, right? And you wish to help them as much as you do not wish to hurt them. And that could be a bittersweet experience. So what are the notable challenges you face, and how do you overcome them?
Okay. If I say treating children is so easy, I will be not doing justice at all. Because even today, there are times when I do feel a bit nervous when I come across few children because of their disruptive behavior. And I'm not worried about their behavior because I know I can manage it. But what concerns me, what makes me a little bit nervous is the fact that because of their behavior, will that affect the treatment outcomes which I'm planning for that particular child? Okay, so having said that, when you say that, you try to help them and you end up, you're scared that you may hurt them. But the point is, we need to remember that we are all humans. When we see somebody crying, the first thing that happens, affects us when we see somebody crying, is we let our defenses down and we worry that, oh, did I hurt this? Why is this person crying? What did I hurt them in any way? And this is the reaction which we always have when we see children. So, but then when children come to us, let's assume there is a child who is in front of you who is bawling. So what you need to think is, why is this kid crying? Because that's where the answer lies. That's what is going to help you in treating these children. So I know the procedures which are going to cause pain to the child, and I know which are the procedures which are not going to cause any pain to the child. So why is the child crying? Is the child crying because he's in pain, or is he crying because he's scared? So if I have answers to either of these questions, it makes my life much more easier. Both can be handled. If the child is in pain, I know how to manage it. If a child is in fear, all I need to do is find out, why are you scared? And the answer helps 9 times out of 10. It really helps. So that is one aspect. The second aspect is, I always remember, I always keep it in my mind that most of the children who come to us, 50% of the children, they are fuss-free. They are so easy to manage. They just walk in, they get all their treatment done, no fuss whatsoever. Okay, because usually we associate, oh, the child is coming, oh my God, the child is going to be uncooperative. But no, 50% of the children are easy, no fuss. Then comes, there are 30% of the children whom I call to be potentially cooperative. When I say potentially cooperative, what it means is that these children, at the moment, they're anxious, they're fearful, they're scared. But then depending on how I interact with them and how I make them feel comfortable, they will become cooperative. They have the potential to become cooperative, but it depends on me. They have the potential to become uncooperative as well. So it all depends on me, how I allay their fears, and then I take them through the treatment. And once they are comfortable with me, they're friends for life. Okay, so that makes it 80% of the children. Then I have 15% of the children who come to me who do not have the ability to cooperate. They cannot cooperate no matter what. It could be because of their age, like a 2-year-old baby. I cannot talk. The baby cannot express. So there is no way I can say, hey, hello, relax, everything will be fine. The kid is not going to understand. And the same way, a child with special needs, there are some children I cannot get through to them. So these are 15% of children, and for them, we have different strategies. Now that leaves me with 5%. That means 1 in 10 children who show really the disruptive behavior. But again, I have my strategies. But then in order to manage these children, I need explicit consent of the parents, especially in today's world where we have hyperparenting and where we have helicopter parents. So I need to be really careful in terms of how I manage these children if the parent does not agree with my strategies. So if the parent agrees, I do what I got to do. But if the parent does not agree with my strategies, I just hang on and say, okay, you please, then probably this is not the best way to treat. So that is the second thing. The third thing we always need to remember when we are treating children, which I remind myself, is patience. I need to be patient with the children. I need to show empathy towards them. And most importantly, depending on the age of the child, I try to go down to the level of intellect of the child. And I go down to their level and I take them along with me. It becomes easier for me when I understand the temperament of the child. So I like observing the child. So for me, the first visit of the child is that much more crucial. So I spend in my first visit, I spend nearly 40 to 45 minutes making the child become familiar to me, or the child, either way, the child is familiar to me, I get familiar with the child, we understand each other, and from there we move on. So just to give you an example, I was treating a kid who was about 5 years, and this kid was accompanied by the younger sibling. So when the younger sibling was about 2 years of age, so since the older one had so much of decay, so the parents wanted the younger one to be seen. So the younger one was bawling. So we said, yeah, it's okay. 2 years old, he's going to cry. So it's all right. And we were examining. So initially the kid we could manage. And then when it actually came, the child needed restorations. And by the time the kid was coming again and again, he turned 2.5. We were just doing follow-ups. And by 2.5, I told the parents, okay, he needs restorations. So the parents said, okay, let's do it. So fortunately for me, the kid could talk at 2.5. He would talk 9 to dozen. He would just talk and talk and talk. But then when I was trying to do a restoration, he was just crying his head off. So then I asked them, and it was getting frustrating for the parents because he's just not listening. He was kicking and screaming. So then we stopped everything. I told the parents, can you please ask what is the reason? Why is he crying so much? So when the parents asked, why are you crying? All he said was, I'm scared of what she's going to do to me. I didn't even do anything. So when I said, oh, this is all I was scared. Are you in pain? He said, no, I don't have any pain, but I'm scared of what she's going to do to me. So I said, okay, that's all, is it? So the kid said, yes, that's all. So then I did what we have the most common thing, tell, show, do technique. I explained to the child, this is what I'm going to do. So don't worry. The kid understood. Fortunately, the kid understood. And in the next 10 minutes, he allowed me to complete all the restorative work for him. And now today he's 5. He walks in with full confidence into the clinic. And in fact, when I don't see him anymore, the students treat him. And in fact, when he walks in, he comes with his cool shades and he sits in the dental chair and he points to the student. This is the area you didn't clean. This is where you need to apply. He just comes for recall checkup and he's fine. And I know for sure that this kid is not going to fear dentistry for the rest of his life. So he is sorted totally. So all it took was a little bit of patience, trying to understand, talking to the child and being empathetic. And of course, the parents were very, very understanding and they are highly motivated. So till today, they keep bringing the child. So it's that way, it's nice. So that way, I can say that it's actually very easy to treat children if you remember these few things.
I see. It takes a lot of analytical skills, asking why this, why that, and also parents do help out a lot.
Yes, of course. Parents play a key role.
Hmm. Okay. Speaking about the challenges, Prof. Uma, you have a good deal of experience in treating children with with special healthcare needs. Do share with us a few stories regarding your experience and how different it is to treat these special children, especially in terms of facilities and procedures.
Okay, so yeah, I have treated a good number of children with special healthcare needs. So if you ask me what are the special facilities you require, it depends. It depends on the special need of that particular patient. So let me explain. I mean, we've had, I'll give you examples of the cases which we had. So for example, we had one child who's around 12 years of age. The parent brought the child because the child has global delay, and global delay of development. Okay, so the parent has already taken the child to a couple of places, but the child couldn't even cooperate for even an oral examination. The child wouldn't let the people examine the mouth. So the parent brought the child to the clinic because one of their family friends, their children were being treated by us. So they said, why don't you come to Manipal and get your child examined? So the mother was mentally prepared. My child is not going to get herself examined again, but she said, okay, never mind, let me give it a try. So she came, and when she came, she told, I have taken my child, and my child does not cooperate, and they've told that the child has to be treated under anesthesia, and I do not want my child to be treated under anesthesia. So I said, okay, if they've already told, fine, we will have a look and let's see. If the child still doesn't cooperate, but I'm afraid general anesthesia is the only way of treating your child. So I said, okay, let's give it a try and let's see how it goes. So then again, our students were assigned the case. They did the basic workup. They took the case history, and the parent they were very patient, and the parent was giving all the history, everything. And when it came to examination, we told the mother, you please sit in the chair and take the child in your lap. Though the kid is 12, is big, never mind, you please sit, because the child is going to feel very comfortable sitting in your lap. And good enough, and to the mother's surprise, the child allowed herself to be examined by the students. I did not examine the child. The students examined, okay? So the child was so comfortable. It took a little longer than normal, but the examination was done completely. So, and then what happened? The kid was comfortable, and the subsequent visits, the child would sit by herself. She got her, so we explained to the mother that we will do a graduated treatment. Initially, we will do just an oral exam, we will do oral prophylaxis. The kid basically needed few extractions of the retained primary teeth, and she needed few restorations. So we explained to the mother, we will do a sequential treatment. And the subsequent visits, the kid would come on her own, sit on her own in the chair, and she would, the only condition the child had was every single visit, it would be the same students treating her, nobody else, not even me. She wouldn't allow me to touch her. She would want only the students. And I must say, the students did a fantastic job. And of course, the kid would say, I want the students. And the mother would request me, doctor, would you please be around when the students are treating? I don't question the student, just for my satisfaction, just be around. So I wouldn't do anything. I would just stand and watch. Whereas the kid, our students are the ones who treated this child, and the child is so happy, and they keep coming for this. We avoid it. So what I'm trying to say is, we could manage the patient on the chair itself. Okay. On the other hand, back in India, I had another child who was autistic, severely autistic, a male child, along with a history of seizures and many other medical issues. So this child again needed multiple extractions, and the child also had a mesiodens. And the mother came to me and said, my child needs treatment. Can you please have a look? And 12-year-old is a big kid. So the mother tried sitting on the chair, but the child would not cooperate. And then we had no choice. So then I had to explain to the mother, we have to treat your child under anesthesia, you know. So the parent agreed. But of course, this child was a high risk for anesthesia. My very good friend was the anesthetist, and she examined and she gave a go ahead. She said, don't worry, it's a high risk, but we can manage because your procedure is very small. So we treated, and the parent was very happy. So what I'm trying to say is it varies from case to case. It's not that every child with special healthcare needs will need particular facilities. There are some cases which you can manage on the chair, but yes, of course, there are many cases where managing on the chair may not be easy. You may need the help of treating them under general anesthesia in the OT. So it varies. You have to assess the case, and there you take it from there. So yeah, that's the way I approach.
I see. Prof. Uma, you mentioned about general anesthesia, and if that kid requires general anesthesia, then does he need to go to the hospital?
Yeah. So with pediatric dentistry, the rights to admission into a hospital is required. So because there are cases there, okay, 50% of, not 50, I would say 70% of my cases I manage on the chair, but there are 30% of my cases for which I need the help of anesthesia, where I treat it when the child is not moving and I can finish. I do a complete full mouth rehab under anesthesia, and then the child comes for regular follow-ups, which I do on the chair. So it becomes much easier that way. So, but again, I say, like, it's not that every case goes under anesthesia. It depends. So you need to be associated with the hospital, because there are certain things which are hospital based. So you need to do in the hospital. You cannot do in your operatory. There are many people who have the mobile anesthetic units in their operatory. It depends on the facility you have. So I personally prefer to be in a hospital setting, because all kinds of backup is there in case of any emergency. There is an ICU and anything, because there are things which happen which you do not anticipate, and things can happen. You have a backup of the hospital, and you can manage. If I have a portable anesthetic unit in my clinic, and an anesthetist comes and treats, in case there's an emergency, I may not have a full backup to manage the emergency. I may not. I'm not saying it is you can't have. Some people have. If you're having it, people make arrangements, but you have to anticipate the unexpected and be prepared for it. So I personally prefer to be working in a hospital where I know all the backup is ready. At just the press of the button, everything is there for you. So you don't have to run around and getting things arranged.
Right. So you mentioned about hospital-based dentistry. It came to my knowledge that you have gained this hospital-based experience from working in India and the UAE. That is an amazing feat, I must say. So could you kindly share with us the experience working in these two countries and how different it is compared to Malaysia's modus operandi?
Okay. I worked in UAE for about 3 years, and most of my career has been in India. As far as the facilities is concerned, I worked with very good facilities with fantastic chairs and fantastic equipment and materials and things like that. And I've also worked in places where things are not so fantastic. But then what I have realized is I'm only as good as my team. Okay, I may be very knowledgeable, I may be very skillful, but if my support is not on the same page as me, my work is not good at all. Let me explain. So I might do a filling, I might do a restorative work, but it's my dental assistant, because I'm working on a child, I have to be quick. And my dental operatory assistant is the one who will be mixing the material. If my material is not properly mixed, and when I place, the restoration may fail. So I cannot blame my assistant saying, oh, the restoration failed because the assistant did not mix it properly. No, it's teamwork. So it's my responsibility. So whichever place I have worked with fantastic teams, whether it was Dubai or back in India. And in India, I made friends with a lot of anesthetists, and I did a lot of multidisciplinary work. I worked with pediatricians, hematologists, dermatologists, ENT specialists. So, and there is a lot of learning both ways. So I learned a lot from them about their specialty. They learned a lot about dentistry. When I used to do full mouth rehabs, the anesthetists were wondering, oh my God, you guys do so much of work in the mouth. So I said, yes, so this is what we do. And then I would learn from them about anesthesia, what they do, how they do, and things like that. So it's very interesting, and I have gained a lot by this multidisciplinary approach, and so much to learn. So yes, coming back to the question, how it is compared to working there and working here. Here also, I must say, we have a fantastic team in our department. We have experience and young blood, and there are so many times we get stuck with some patient comes and you wonder, okay, how do I approach? So we have a case discussion. Okay, this is how maybe we should approach it, and we do a discussion, and we have a very good support staff. Our dental surgery assistants, they all know each one of us how we operate, and they know how to arrange the things for us and keep things ready. And there are times when they know they will be all hands on deck. If I'm treating a 2-year-old or 1.5-year-old, they know all of them have to be there to assist me, because because the kid is bawling, and we need to sometimes hold the kid, or some others have to mix the material, and there is a runner, so we are all there. So we have a fantastic team. So everywhere it's the same. But what depends is the teamwork. End of the day, it's the teamwork, and that's what leads to having a very fulfilling work. So yeah, that's how I enjoy my work, working with great teams.
I couldn't agree more, really.
Yeah.
Teamwork's everything. So
yeah.
Now let's talk about an organization that serves for a good cause. You are a fellow of the Foundation in Advancement of International Medical Education and Research, FAIMER. What are your roles and responsibility as a member, and what are some of the work the foundation has carried out to achieve its vision?
Okay, so the FAIMER, of which I'm a fellow, it is basically set up to improve the healthcare system by empowering the education, medical education. Okay, so basically, I am a clinician. I'm a trained clinician. Okay, so I know about research. I know about how to treat patients. But if I come into academics, I am not so well trained in about teaching learning activities or student assessment and things like that. So by being a fellow of FAIMER, it has empowered me rather in getting to know newer teaching learning methods. What are the ways to make the classes more interesting, how to have newer methods of assessment and make it more tangible, and also make it more fair across the board for all the students, so that students don't feel that there is some kind of bias, if there is fairness. And so there's a lot of research which we do, and we are basically, the end goal is to make the students, the future professionals, their education more enriching, and we know that when the student graduates, he knows all the things which he's supposed to know, because at the end of it, if the student knows everything, it's the community which is going to benefit, right? It's the community at large which is going to benefit from the clinician. So it is more for the training of the future dentists or medical professionals. So as part of it, I'm the chairperson for the soft skills committee in the college. So because one of the outcomes for students, the new dental graduates, is also that they practice ethically and professionally. They exhibit professionalism. So as part of that, because FAIMER trained me, and so we conduct assessment of professionalism for our students in year 4 and year 5. So in year 3, we give them some kind of orientation about what is professionalism, what is expected of them, what they should do, what they should not do, and then we assess, and the students are given feedback from their friends, from the faculty, from the dental support staff, from the office, from their friends, and they assess themselves, and we tell them, see, you're good in these areas, but this is the area where you can probably improve yourself. So we give them a constructive feedback, which possibly will help them in future, because we are all in a professional institute where you're being trained in a particular profession. So we need to exhibit professionalism so that there are no problems later in life, because today things are always taken out of context. So it's better to know the do's and don'ts so that it will help you in your career later in life. So that's how FAIMER has empowered me, and there is a lot of research. So we do a lot of research related work with student education. Yeah.
I've read a little about FAIMER, and they are very targeted on developing countries, right?
Yeah.
So how about the developed countries? Do they have some similar organization as such?
So in developed countries, see, they already have their structured professionals education, right? So these developing countries, they want them, because we have a lot of graduates from developing countries going into the developed countries, graduates, say from India going to UK. So they have to match their standards, right? So in order to ensure that they match their standards, so the kids back in the developing countries need to be trained so that, they can go. And also universally, the standard will be the same. So it doesn't make a difference where you study, right? Because all the parameters are almost the same. Because I remember, I know what difference it has made, because I remember when I was studying, for us, the assessment, like in the exams, so we used to have 2 long questions, long essays. Define dental caries, give the etiological factors, how do you manage? Long essay, 20 marks. Now you go on and write. And how do you assess? So we always used to wonder, how do they assess? So for, but now that thing has changed. So it's more about application, right? So things have changed. So that makes the student also will improve, because there's a lot of analytical thinking, application comes. So it's not about only theory. You also have to apply whatever you have learned. You have to apply, put them together. And because when it comes to patient, it's not theory. You have to apply what you have learned. So with FAIMER, we learn those things. What are those things which will help the students? So in the clinics, what are the things you can do to make their assessment more realistic, and which the students will also appreciate? So they don't feel, oh, I'm being grilled. No, it's something where we give constructive feedback, and they learn from it. And there are so many things in it. So it really helps in the teaching learning activities, and as well as the assessment of the students.
Okay. Moving on, Prof. Uma, you have been working in this field for about 20 good years. You have seen a lot of things, right? In your opinion, how has the pediatric dentistry evolved throughout the years?
Okay. Now, if I say anything about pediatric dentistry, it will sound as if I'm trying to sell, but that's not it. The point is, in pediatric dentistry, when I studied in pediatric dentistry, we tend to do everything of dentistry in pediatric dentistry. So what do I mean? When I see a child, I can do endodontics for the child. I do prosthodontics. I do orthodontics. I can do surgical procedures. Okay, so basically everything of dentistry in a child can be done. So pediatric dentistry that way trains me about everything. Okay, so yes, the scope is huge. Okay, so therefore, if you say how has pediatric dentistry evolved, so pediatric dentistry has evolved as much as dentistry has evolved itself. So therefore, all the technology which has come into dentistry is applied in pediatric dentistry. So how so? For example, you have a rotary endodontics. We do rotary endodontics in primary teeth. Nowadays we do zirconia crowns in permanent teeth. We have zirconia crowns for children as well. So I think we do interceptive orthodontics. We do preventive orthodontics. So the only thing which we do not do is only implants, because there is a restriction because of the age. The child's growth is not completed. So implants is the only thing, that area which we don't go. But then there are still situations in children where they say you can give implant, like a child with ectodermal dysplasia or anything with multiple missing teeth or things like that, where people have tried. It's not accepted, but people are still looking at it, whether it can be done. But implantology is the only area where we do not go. But in pediatric dentistry, we do everything. So how has it evolved? Whatever technology has come in dentistry, everything is there in pediatric dentistry. So everything goes. So we grow along with rest of the dentistry.
Okay. So final question, what advice would you like to deliver to dental students, especially those who aspire to further their studies in pediatric dentistry?
Okay. First of all, congratulations for choosing pediatric dentistry as your next step, because as I just said, the scope is huge. Okay, so I've seen many of our students who, after graduating, once they go into the ministry and they're doing their government job, they come back, and when we have conversations, they come and say, wow, there is so much to do. Yeah, there are sometimes situations where we feel overwhelmed by the child's behavior, but most of all, there is so much we can do. And we have seen there have been a couple of students who are actually actively looking at pursuing peds as their specialty, as the next step. We have our students, and it's very, very encouraging, and it's very heartening, because as I said, if you want to choose pediatric dentistry as your next step, the scope is huge. Whether you want to go into academies or you want to go into private practice, the scope is huge. The only thing limiting factor could be as I said, with peds, there are 30% of your patients who you may not be able to treat them on the chair in your operatory. You will need to be associated with a hospital you need to have admission rights to admit your patients, because while you may do it as a daycare procedure, but still you need admission rights, because every country has their own regulations. So you need to follow those and see. So you need to be associated with a hospital, and then sky is the limit. You can do so much work, be it orthodontics or surgical procedures, or you want to just be with special healthcare needs children. There is so much. Traumatology is one more thing. Scope is huge. So if you want to pursue pediatric dentistry, good decision. My best wishes. And of course, there is a lot of hard work that goes without saying, because post-graduation is all about being on call. Peds means you will be on call because of trauma. So you will be prepared. You should be prepared to handle call. You will be on calls. You have your lectures, you have your seminars, you have your clinical work, you have your research work. So you would wish that there were more than 24 hours in a day. But then at the end of it, it will be worth it, believe me. So it will be very nice. You will feel very satisfied. At least I feel very satisfied. In fact, today, I really cannot handle, honestly, I prefer treating children. A lot of people ask me, how do you manage children? I said, I prefer treating children rather than the adults, because I feel very comfortable. So you may not believe it, but that's a fact.
I see. So it's all blood, sweat, and tears, right? Nothing.
Yes. You need to define your end goal for yourself and see what is that makes you happy, and just pursue it. Because that is what will get you happiness and nothing else.
Very true. Now, here comes the most exciting part of the interview that you have been waiting for, the rapid fire round.
God.
Yeah.
All right.
So I'll be
Bring it on.
Yeah, I'll be asking you 10 questions very quickly, and Prof. Uma, you have to answer them quickly as well. Okay?
Okay.
So you ready?
Okay.
Okay, here we go. Favorite Malaysian food?
Favorite Malaysian food? I'm a vegetarian, but still my favorite vegetarian food is vegetarian nasi lemak. And my favorite place is the Botanist in Malacca. I just had it yesterday, by the way.
Your role model?
Ooh, my role model. Christian Amanpour of CNN.
What is the secret to look elegant like you?
I believe in myself. I believe in myself. That's it. Yeah. I don't conform to any other norms. My norms are created by myself for my own self, and that's it. I believe in myself. That's it.
Things you do in your free time?
Oh, that list is huge. But unfortunately, my mobile phone takes a lot of time away. But the things I love to do: reading, gardening, crocheting, tatting, and cooking, in that order.
Okay. If you weren't a dentist, what would you be?
A pilot.
Ideal retirement place?
Back home in India, in a small place with a small house, and that's it.
Okay, this one is prescription of medication for children with acute or chronic dental abscess.
I will not answer that.
Let your students answer that.
I know from where it is coming. I'm not going to answer that. Figure it out for yourself.
Which movie would you like to live in and why?
I'm old school, so yeah, I like what is that? Pretty Woman. Then it's very old, very old. I mean, it's it's nice to see some mushy and romantic thing. Makes you feel like life is very nice and everything.
How did you learn to be articulate and proficient in speaking?
Oh, I did not learn. Okay, it's when I was growing up in the north of India. I studied in an English medium school, but we were taught in the local language. Okay, so though it was English, but we were taught in the local language. Okay, so my thought process is always goes back to my local language, not my mother tongue, my local language, which is Hindi. So when in a crunch situation, I think in Hindi first, not in English. It's not my first language. But over the years, I have learned. I watch a lot of TED Talks and things, and I have a lot of good friends who are very well articulate. And of course, my family is very articulate, and they are my best and the worst critics. So they are the ones who help me in improving myself. So yeah, so I won't say I'm very articulate. I still need, there's a lot of room for improvement.
What advice would you give to your younger self if you could travel back in time?
Don't be hard on yourself. Take it easy, is what I would tell myself.
Enjoy the journey.
Yes.
We've now come to the end of the rapid fire round session. Prof. Uma, thank you so much for being a good sport answering all these questions. Right, I personally do enjoy this interview session. With your answers, you made me have an open mind, on how we dentists to be are not only destined to treat patients or children in the dental chair, but to also be a part of the effort, regardless big or small, to make the world a better place. I like to quote, with knowledge comes great responsibility. Anyway, we have come to the end of the interview session. See you all in the next episode of Interview with Experts Season 6. Goodbye. Bye, Prof. Uma.
Bye. Thank you so much.